Merkel cell carcinoma (MCC) is a rare but aggressive skin cancer that starts in tiny cells called Merkel cells. These cells help us feel light touch. MCC usually appears as a fast-growing lump on the skin, most often on the face, neck, or arms. Think of it as a surprise guest that shows up quickly and needs fast attention. Infection with a virus called Merkel cell polyomavirus, which can change cell DNA. Long-term exposure to ultraviolet UV light from the sun or tanning beds. A weak immune system, such as in people with HIV organ transplants or older age. Imagine UV light as a harsh sun that slowly damages the skin's blueprint, while the virus acts like a sneaky hacker, inserting bad code. Typical signs include a painless firm bump that is pink, red, or purple. The bump grows quickly, weeks not months. It may look like a cyst or a harmless mole. Sometimes it ulcerates, breaks open, or bleeds. Try a quick self-check. Look at the skin on your face, neck, and arms in a mirror. If you see a new, fast-growing spot that feels firm, note it and talk to a doctor. To find MCC, doctors usually do a skin exam and take a small tissue sample, biopsy. Test the sample for the virus and for special markers under a microscope. If confirmed, they may order imaging, CT, PET, to see if cancer spread. Treatment often starts with surgery to remove the tumor, followed by radiation to the area. If the cancer has spread, medicines that help the immune system, immunotherapy, are the main option today. Imagine the treatment plan as a 3-step recipe. Cut out the visible part, bake the surrounding area with radiation, and add a powerful immune spice to fight hidden cells. Because MCC is linked to UV light and a weak immune system, prevention steps include wearing sunscreen, SPF 30 or higher, daily and reapplying every 2 hours. Wearing hats, sunglasses, and protective clothing when outdoors. Avoiding indoor tanning beds. Staying up to date with vaccinations and managing health conditions that lower immunity. For example, controlling HIV, careful use of immunosuppressive drugs. Try a weekly reminder on your phone to apply sunscreen before you step outside. Recent advances focus on immunotherapy drugs called checkpoint inhibitors. For example, pembrolizumab, nivolumab. These medicines release the brakes on the immune system, allowing it to attack MCC cells more effectively. Clinical trials from the last few years show higher survival rates for patients using these drugs compared with older chemotherapy methods. Researchers are also exploring blood tests that can detect the Merkel cell virus early, which could help diagnose the disease before it spreads.